How do testicular cancer myths impact masculinity? Many men face not only the physical challenge of testicular cancer but also emotional hurdles shaped by myths and misconceptions. These false beliefs can deeply influence how men see themselves and their masculinity after diagnosis. It's important to understand that these myths often stem from cultural stereotypes and lack scientific basis, but their impact can be very real and very harmful. One common myth is that testicular cancer only affects older men. In fact, it is most common in men between the ages of 15 and 40, especially those aged 20 to 34. This misconception can cause young men to ignore symptoms or delay seeking medical help, thinking they are not at risk. When young men believe they are invincible or not vulnerable, they may miss early signs, which can lead to more advanced disease and greater emotional distress later on. Recognizing that testicular cancer can affect men in their prime years helps promote early detection and reduces unnecessary fear. Another myth suggests that injury or trauma to the testicles increases the risk of cancer. There is no scientific evidence supporting this idea. However, this myth can cause men to feel anxious about sports, physical contact, or even everyday activities that might involve the groin area. Such fears can lead to unnecessary worry and social withdrawal, which can harm mental health and self-esteem. Understanding that injury does not cause cancer helps men feel more confident and less fearful about their bodies. Many also believe that cancer treatment will inevitably ruin sexual performance or make men infertile. While some treatments can affect fertility temporarily or permanently, not all men experience these issues. The myth that treatment always causes sexual dysfunction can create anxiety even before treatment begins. It's crucial to know that many men recover sexual function and fertility after treatment, and options like sperm banking are available to preserve fertility before therapy starts. Accurate information can help men approach treatment with less fear and more confidence. There's also a false idea that lifestyle choices like diet or exercise can prevent testicular cancer. While maintaining a healthy lifestyle is always good for overall health, it does not guarantee protection against this disease. When men believe they can control or prevent cancer through personal habits, they may feel a false sense of security. When diagnosed, this can lead to feelings of failure or guilt, which are unnecessary and unhelpful. Recognizing that some factors are beyond personal control helps men accept their diagnosis and focus on effective treatment and early detection. The impact of these myths extends beyond physical health. Many men experience a sense of loss or diminished masculinity after losing a testicle or undergoing treatment. Some interpret this physical change as a symbol of reduced manhood, which can lead to feelings of shame or lowered self-esteem. These feelings are often reinforced by cultural stereotypes that equate masculinity with physical strength and reproductive ability. Such beliefs can make it harder for men to talk openly about their feelings, leading to emotional isolation and depression. Furthermore, myths about masculinity discourage emotional expression. Men may feel they should be strong and stoic, avoiding discussions about their fears or struggles. This emotional restriction can worsen mental health and hinder recovery. Men who lack support or who believe they must handle everything alone may experience higher levels of anxiety and depression. Recognizing that vulnerability and emotional openness are signs of strength, not weakness, is vital for mental well-being. In the broader context of reproductive cancers, these myths can distort how men view their identity and social roles. Since testicular cancer involves organs central to male biology and reproductive capacity, misinformation can create additional psychological barriers. Men might feel ashamed or worried about their future ability to have children or maintain relationships. Dispelling myths with factual, science-based information is essential to help men regain confidence and maintain a positive sense of masculinity. The good news is that accurate knowledge and strong support networks can help men navigate these challenges. Men who receive truthful information about the disease understand that early detection saves lives, and know that treatment outcomes are often positive tend to cope better. They report feeling more in control and less defined by their illness. Encouraging open conversations, providing psychological support, and promoting realistic expectations are key to preserving masculinity during and after treatment. In conclusion, myths about testicular cancer can threaten a man's sense of identity, confidence, and emotional health. By debunking these false beliefs, we empower men to seek early help, face treatment with resilience, and maintain their sense of self. Remember, every man's experience is unique, and personalized medical advice from healthcare professionals is always the best course of action. Accurate information is a powerful tool in overcoming fear and strengthening masculinity in the face of cancer.